deep cavities do not appear overnight. Decay slowly breaks enamel, then spreads into the softer dentin underneath. First, a dentist checks how far the cavity has traveled, often using exam tools and dental X-rays. Before treatment, the area is usually numbed and isolated so the tooth stays dry and comfortable. The dentist opens the damaged area carefully, removing weak enamel to reach the infected dentin. Soft, infected dentin is removed in controlled layers, while as much healthy tooth structure as possible is preserved. If decay is very close to the nerve, dentists may slow down and protect the pulp instead of over-throttling. After cleaning, the cavity is disinfected and sealed with protective materials before the final restoration begins. For many deep cavities, tooth-colored filling material is layered and hardened to rebuild the missing structure. If the pulp is infected, a root canal may be needed. If the tooth is too weak, a crown may protect it. Final polishing restores bite and smoothness. This video is educational, not a diagnosis. See a dentist for personal care.